So self-esteem is one of these concepts associated with narcissism that has been misused and misinterpreted and become much more provocative and not at all described or identified in a way that can make sense for people. And it's also often labeled in terms of black or white. You either have high self-esteem or low self-esteem, and it's associated to a whole bunch of negativity. And self-esteem has to do with courage, motivation, and also what I call sense of agency, namely that you can feel that you are in charge of what you are doing. I am the one moving my right hand from here to here, and that's me. And with that sense of connecting self-esteem and sense of agency, you get more into self-esteem as a process. As something that is like a building process associated to goals, aspirations, a sense of competence, courage, and taking steps that build forward. But it also has to do with tolerating the rainy days, the steps back, tolerating failure, and seeing failure not as I am a failure, but I did something that wasn't as perfect as I wanted. And why was that? That was because of these conditions. So in other words then, as I have worked on this in psychotherapy with these patients, is to really look at it in a progressive process term, so not in this kind of I'm a failure, I have a low self-esteem, or I'm grandiose, I have high self-esteem. That doesn't make sense.
Right, and also that people will do things to regulate their self-esteem.
Yes,
right?
absolutely.
So people will do, and what is it with sort of that you find with people who you treat who would fall into like an NPD category with regard to what things they do to regulate self-esteem?
You're sure, but for instance, then the whole self-worth is based on am I perfect or am I not perfect? And the sense of identity that can then be based or identified in terms of self-esteem, that I am a failure, for instance, or I'm not perfect, I should be perfect. Mm-hmm. That in and by itself then can escalate other narcissistic tendencies or patterns, competing, avoiding, dismissing other opportunities. And
are the people, when you're seeing patients, because NPD people have such a bad name on the street, I mean, it comes in all flavors. So are NPD people likable, or are they varies, right? Like it's as varied as...
Some are likable, many are extremely interesting, some are extremely challenging, but they are human beings.
One of the things that I thought was interesting when I was reading your material is your ability to talk about their internal experience. And I thought at the time, to do your job, you have to be able to have a level of like empathy. You have to understand their experience is that correct? In other words, the thing that people accuse NPD-ish people of is not having empathy, but that's the very thing that then they're doing to that person is not really having empathy for them. And so I thought it was interesting that you sort of have to have that to
you're pointing to a very, very complex thing here, which has to do with in what way sort of empathy in its classical, conventional way can be useful or not useful in treatment, and in what way listening, validating, exploring, confirming reality, and confirming gradually difficulties in reality in a way that the patient can tolerate talking about. And this can take a long time. Somebody comes from seen an accident or something really, really tough, being fired or something. And if I, as a therapist, then start to be too, oh, that must have been horrible, that may be too much for the patient at that time. And to understand and see that this was a tough experience. Can you say more of how it was for you? Then we are on a validating track that can gradually help the patient come to more deeper feelings. And that is different compared to working with patients who do not primarily have narcissistic pathology, that they can more readily and easily take in a very empathic intervention and open up and feel comfortable and confident in their own experiences. But that is something that narcissistic patients have much more difficulties doing and tolerating, and it can take time. And that has to do with emotion tolerance and feeling that they can be in control. And